Yes po, Doc.
Okay, see. So this is just a continuation with the lecture with the traditional Chinese medicine. So as I promised, the last time that I talked to you or have lecture with you was ang katapusan na nasa rin ako that we will be dealing with how the traditional Chinese medicine doctors diagnose, no? How they diagnose their patients. So there are 8 principles of diagnosis at traditional Chinese medicine, no? It is the process of determining which actual pattern is on hand. No, ang pattern nga kung ginyakan na iyuhan una, ang meridians, ang yin and yang, ano? So, it is called pattern diagnosis or pattern identification or pattern discrimination. Generally, the first and most important step in pattern diagnosis is an evaluation of the present signs and symptoms on the basis of the 8 principles. So they have their 8 principles. So just like our medicine, no, Western medicine, the most important step also in our diagnosis is you evaluate the signs and symptoms of your patient. No? So on your second year, I think you will be having your clinics. You can have a taste of how to diagnose your patients. No, you will be taught how to diagnose, no, with the basis of your Aya Purpal. No, who knows Aya Purpal here? It's an acronym, guys. Aya Purpal, no? Not yet. It's inspection, percussion,
assessment, percussion, palpation.
Ano pa? Inspection,
Palpation.
Auscultation.
ano pa?
Auscultation, palpation.
Inspection, auscultation, percussion, and palpation. Okay, that's Aya Purpal. And you will be taught by your second year at UPAG clinics about that. Okay, so the 8 principles of the diagnosis of the traditional Chinese medicine are these, no? It's a paired, no? These 8 principles refer to 4 pairs of fundamental qualities of a disease. It may be exterior or interior, maybe heat or cold, maybe excess or deficiency. It may be yin or yang. No? So out of these, heat and cold and excess and deficiency have the biggest clinical importance. Okay. So the yin and yang quality on the other side has the smallest importance and is somewhat seen aside from the other 3 pairs, since it merely presents a general and vague conclusion regarding what other qualities are found. So medyo vague it yin and yang. So and heat and cold and excess and deficiency amot major good, no, pag-diagnose. So yin and yang are universal aspect. All things can be classified under this includes the diseases in general as well as the 8 principles. No? For example, cold is identified to be a yin aspect, while heat is attributed to yang. Cold deficiency and excess heat patterns, who are sometimes referred to as yin patterns and yang patterns respectively. So, let's start first with the exterior and the interior. When we say exterior, it refers to a disease manifesting in the superficial layers of the skin or of the body, I mean. So skin, hair, flesh, and meridians. So it is characterized by aversion to cold or wind, headache, muscle ache, mild fever, a floating pulse, and a normal tongue appearance. Okay, exterior, it's very fundamental. When we say interior, it refers to a disease manifestation, hazang fu, or in the wider sense, hasulod, no, to any disease that cannot be counted as exterior. There are no generalized characteristic symptoms of interior patterns since they'll be determined by the affected Xing or Fu organs. Okay, but at the level, at the superficial level, you may say if it's exterior or interior, and then when you say it's interior, you will go deeper to what organ or what Zang or what Fu organs are affected. Okay. There is also what we say, what we call cold. No, cold is generally characterized by aversion to cold, absence of thirst, and a white tongue. No? More detailed characterization depends on whether cold is coupled with excess or with deficiency. So, medyo nagtitika-complicate na hiya. No? So, yeah. While heat naman is characterized by the absence of aversion to cold, a red and painful throat, a dry tongue, and a rapid and floating pulse. In all other cases, symptoms depend on whether heat is coupled with, again, excess and deficiency. Okay? So, this is a presentation or a representation lang of the cold wind colds and the warm wind colds, because traditional Chinese medicine, there is warm cold or a cold cold, no? And sipon, nga mahagkot or and sipon because of heat. Okay? But both of these, they have nasal congestion, you have cough, you have headache, you have fever, you have aching limbs, or what we call the influenza-like illness, aton nga Western medicine. Okay? So, the only difference from these two are, if you have the cold colds, no, you have chills worse than the fever. Basgin kakadal ka kaysa kagin kakamay da kaharana. Okay? You have sneezing, you have thin phlegm, you have itchy throat, you don't sweat, no? And you have a pale and thin coating of your tongue. No? You may if you have colds, no, kamo pwede niyo kitaon kung i-differentiate niyo kung cold wind colds kamo or warm wind colds, no? But if you have warm wind colds naman, your fever is worse than your chills. So mas haranat ka, no, than having kadal. No? You have runny nose, you have thick yellow phlegm, you have sore swollen throat, you have little sweating, you have tongue yellow with a thin coating, and you have swollen glands, your lymph nodes. Okay? So, we go to deficiency and excess. When we say deficiency, it can be further differentiated into a deficiency of your qi, of your shu, or of your yin and yang, with all the respective characteristic symptoms. But yin deficiency can also cause empty heat. So, bagat feeling niyo mapaso, but your body does not manifest the fever. It's empty heat. Okay? Excess naman generally refers to any disease that can't be identified as a deficient pattern, and usually indicates the presence of one of the 6 excesses or a pattern of the stagnation of your qi or your shu. In a concurrent exterior pattern, excess is characterized by the absence of sweating. So here, your yang are your yin, your exterior, interior, your excess and your deficiency, your heat and your cold. Okay? Exterior, you have your skin, your hair, your flesh, your meridians. Your interiors, you have your organs, your bone marrow, your qi, or your lymph, and blood. Okay? When we say naman excess or your shi, it is a disease preventing the forces. So when you say you have when traditional Chinese medicine considers you to have an excess, it means you have pathogenic factors. You have viruses or you have bacteria, in your body. If you have deficiency naman, you have no pathogenic factors, no, waray virus, waray bacteria, but you are just deficient with your qi or your shu or your blood, no? Then you have your heat, your cold. It's a yin deficiency. When you have heat or when you have cold, it's a yang deficiency. Okay? I know it's very tedious, no, to learn about this because traditional Chinese medicine really takes practice. Okay? Bisan ako, I'm not very very adept, no, to traditional Chinese medicine, but you could apply a little thing, no, or two to your patients when the time comes. Okay, so I'm just going to show you this. This is there's some food samples with the different energies, no, on your your yin, your yang, So these are the food samples, no, ngayon pwede makita. So if you have yin deficiency, you can you can give your patients this food, no. If you have yang deficiency, you can give this. But if you want a balanced yin and yang, these are the food that you need to give to your patients, no. Your round grain rice, your corn, your sweet potato, no, carrots, cabbage, no. I think it's really found lang naman in our normal diet. So, after the fundamental nature of a disease in terms of the 8 principles is determined, the investigation focuses on more specific aspects. No? So, after the traditional Chinese doctor deals with the 8 principles, with the heat and cold, with the yin and yang, with the excess and deficiency, no? They focus na on the more specific aspects. By evaluating the present signs and symptoms against the background of typical disharmony patterns of the various symptoms, evidence is collected whether or how specific symptoms are affecting each organ. So, in traditional Chinese medicine, there are 5 diagnostic methods. No? And akong ginyakan haiyuhan una is with the Western medicine, we have Aya Purpal. Inspection, we have auscultation, we have percussion, and we have palpation. Okay? In TCM, we have inspection, we have auscultation, we have olfaction, no? They smell, and they do inquiry, and they do palpation. Okay? So when they say, in traditional Chinese medicine, when they say it's inspection, you know, it's just like our inspection in a Western medicine. You inspect, the inspection focuses on the face and particularly on the tongue. No? Amot inspection natin from head to toe, no? But for traditional Chinese medicine, they really focus on your face. They focus on the tongue. No. I have encountered a traditional Chinese doctor that can determine if your face is puffy, even if you are fat, no, or if you're chubby. They can determine if your face is puffy, and they can tell you that you have an excess in your sodium, no, damon asin hay mulawas, no, because of your puffiness. So, and they deal also with your tongue, no, including analysis of the tongue size, the shape, the tension, the color and coating, and the absence or presence of teeth marks around the edges. Now, I will be showing to you later on a picture of the diagnosis, traditional Chinese medicine diagnosis of the tongue. No? Then we go to auscultation. So auscultation refers to listening for particular sounds, such as wheezing, such as crackles, no? And yung mga nababatian na use stethoscope. Now, I know you still don't know how to do, you still don't know how to listen, or some of you knows already using a stethoscope. On your second year, you will be taught how to use the stethoscope, how to listen for your breath sounds. And it's really difficult because there's a big difference. There's a little difference lang on a normal breath sounds, and then when you hear such crackles or fine rowels, no? I know parang very vague pa iyo, no? The only thing that when I was a second year, that I can differentiate really was wheezing, because wheezing is very, very, very particular, no? Wheezing kasi nababatian mo talaga, it's a sound, no? But with the crackles and the rals, it's really different. When we say crackles or rals, have you tried your hair or your mga long hair na mga girls or your mom's hair nga mabatian niyo if you rub it like that? That's the particular sound that you would like to hear if you want a crackle or a rouse, no? And when you hear that sound during inspiration or expiration, sometimes it deals with having in pneumonia or having cough, no, of your patient. Okay, but you will learn it when you have your clinics. Okay, on the traditional Chinese medicine uses, no, is olfaction. It refers to attending to body odor. So, particularly, olfaction refers, no, to the smell of your patient. No, they deal with the smell. No, kita Western medicine, Filipinos per se, no, bagat papareho man it hamot it mga pasyente hospital, lalong-lalo na if it's in a government hospital. But no, when you do with olfaction, really, dapat imo sense of smell is very keen, no, because there's a particular body odor to a particular disease. No. Number 4, they do the inquiry or your interview when we do with our Western medicine. No, they focus on the 7 inquiries, no, which involves asking the person about the regularity. No, it's just like the Western medicine. How regular is your pain, or how regular kung ano yung symptoms nga ginaabat. No, the severity. Now, in severity, we ask on a scale of 1 to 10. So ganito, on a scale of 1 to 10, 10 being the highest, how severe it is. No, or other characteristics of chills, fever, perspiration, appetite, thirst, taste, defecation, urination, pain, menses, leukorrhea, or sleep. So it's just like Western medicine. No? Kumusta, ani mo appetite, kumusta timpandrasa, nakauro ka ba, nakaihi ka ba? Di ba? The nurses here will understand that. Now, during your rounds, you really ask your patients, how many times have you defecated? How many times have you urinated? And then you even ask for a particular how many ml, no? Or how was the characteristic of your sleep, diba? And then the 5th one is your palpation, which includes feeling the body for tenderness, your ashy points, no, or the location of the pain, the palpation of the wrist pulses, and the palpation of the abdomen. Okay. Now, tongue and your pulse. Ang pinaka with the other or inspection that you do or palpation, no, the tongue and the pulse in traditional Chinese medicine are the most common used. No, if you could see mga Chinese nga mga documentaries or mga Chinese, even the Chinese historical dramas, no, makikita niyo that they are really particular with the pulses and with the tongue. No? Sino nagkita din yan, Jangyum? No. Sino nakakita ng Jewel in the Palace? Up to now, no, gibabalik-balikot nga Jewel in the Palace. No. 52 episodes ito ni. No. If you could see, no, pag may da sakit hira, no, Korean ini but you know, Korean has been influenced by China. No? Korea, I mean, has been influenced by China. So if makikita niyo yung mga episodes nila, pag may ada sakit and pasyente nila, they really do the pulse. They palpate for the pulse, and then they kikita nila ang tongue. Okay? So, the examination of the tongue and the pulse are among the principal diagnostic methods in traditional Chinese medicine. Certain sectors of the tongue surface are believed to correspond to Zhang Fu. No? For example, teeth marks on one part of the tongue might indicate a problem with the heart, while teeth marks on another part of the tongue might indicate a problem with the liver. So mas mahuri, mas kailangan talaga yung studyhan if you will really deal with your traditional Chinese medicine. So this one, which tongue are you? These are the 9 common syndromes and possible symptoms, no, if you see your tongue na sugat. The normal, that's just like that, very pinkish, no, If you have a Chi deficiency, amon makikita niyo, you have a thin white coating, teeth marks, pale tongue with a few red spots. You know, when I was an intern and still a moonlighting resident, makikita ko gihapon ng mga pasyente pag dani na tongue outera. May na talaga, no, makikita mo may na mga whitish nga mga flakes or coating, no. And then we just don't particularly give importance, no. Pero yan ang nagsa-study kita about traditional Chinese medicine. Makikita mo nga may na talaga importansya, no. Makikita mo, no, nga it really deals, no. For example, you have heat or you have fever. Try daw lang niyo, if you have fever, di ko ibig sabihin dapat magka-fever ka mo. But if you have fever, try looking at your tongue. If really pareho hinihit, may dahit, no? If you have blood stasis, your tongue looks like this. If you have chi stagnation, you are stressed. Kamo nga tanan, stressed ka mo yan, ano? Kita daw, kung may nakamo chi stagnation, tuman stress, tendency to be depressed and upset, unstable emotional state, kita daw kung ito yung tongue, pareho ito. No? If you have yang deficiency, your tongue will look like this. If you have yin deficiency, you have like that. And you blood deficiency, you have like also like that. No, I will be giving to your president na lang or to kung hinot in charge sa iyo. I will be giving you these slides after the lectures also, so that you will have a copy. Okay. Don't worry if my exams, my quizzes will be found only on the PowerPoint. Okay. So I think this which tongue are you is maupay nga may ada kamo iyo cellphone, madagmit la nga reference. Okay. Now, pulse palpation naman involves measuring the pulse at a superficial and at a deep level at 3 different locations. Now, in Western medicine, na aton pulse are just like here, 1 point lang, di ba? With the index and the point finger gagamit naton, no? Index and middle finger, I mean, no? And then here lang, no? Nakikita niyo. At a superficial level lang, but in traditional Chinese medicine, the superficial and they do with the superficial and the deep level at 3 different locations on the radial artery. How Western medicine, usalat location, the radial artery. But in traditional Chinese medicine, the radial artery has 3 locations. It's what they call the kun, the guan, and the qi. They are located 2 finger breadths from the wrist crease, 1 finger breadth from the wrist crease, and the wrist crease, no, respectively. Later on, I'll be showing to you a picture and a video on how to do the palpation with regards to the kun, guan, and qi. No? Usually, they are palpated with the index and the middle and the ring finger. So, tulo. No? Ikita, traditional aton Western medicine, we just do with this. No? But with traditional Chinese medicine, 3 fingers. No? For a total of 12 pulses, usually palpated with the index, middle, and ring finger of each arm, for a total of 12 pulses, all of which are thought to correspond with a certain Zhang Fu. So, really, traditional Chinese medicine is very particular or very hard to learn. No? So, I have been really amazed with the traditional Chinese doctors nga, with just a pulse, makakasabot hira if you are pregnant. With just your pulse, they can see if you are having a disease, no? Ano ti mo sakit? Liver, heart, stomach, no? It's really amazing, no? Pagkita ira. Now, the pulse is examined for several characteristics, including rhythm, strength, and the volume, and described with qualities like floating, slippery, bolstering-like, feeble, thready, and quick. Each of these qualities indicates certain disease patterns. No? So learning PCM, pulse diagnosis, can take several years. So here, there are 6 positions, three levels, your kun, your guan, your qi. No? So in your left hand, your kun, your guan, your qi corresponds to the following organs. No? Your kun left is your heart. Your guan in your left is your liver. Your qi in your left is the kidney. In your right naman, your kun is the lung. Your guan is your spleen. Your qi is the kidney. No? Yun. So medyo makuri talaga siya, maintindihan, no? It will really take time for you to practice, no? Yun. So I think with the diagnosis, with the pulse diagnosis and other diagnosis no na akong gin-discuss, I will end my lecture with this because next time I'll be dealing with acupuncture and moxibustion. But after that, we will be dealing with the DOH laws already and the department secretaries. No? I'll just be showing to you a video clip para early gihapon kita matapos. No? Because my staff are already here. We are really going to prepare for the deployment of the doctors no? To the different to NCR. I'll just show you a video clip on the pulse diagnosis, no? Kung paano.
Was bringing acupuncture.
Nakikita niyo na akong share.
Yes po, Doc.
Okay.
Hi, this is Challen Yi with bringing acupuncture mainstream, one talk at a time. Today I want to talk very basic terms about one of the fundamentals of Chinese medicine diagnosis.
Can you hear the audio? Nabatian niyo kanina ng audio? Gin-pause ko lang yan. Can you hear the audio?
Yes, Doc. Yes po, Doc.
Okay, sige.
And that is taking. Hi, this is Challen Yi with bringing acupuncture mainstream, one talk at a time. Today I want to talk very basic terms about one of the fundamentals of Chinese medicine diagnosis, and that is taking the pulse. Now, if you've ever been into an acupuncturist office or a herbalist or some other form of Chinese medicine doctor, you will often sit down and look at your tongue and also look and feel your pulse. And I'll explain some of the very basic differences between checking a pulse in the Western doctor's office and checking a pulse in the Chinese medicine doctor's office. That when you're taking your pulse in the Western medicine doctor's office, you're just taking the heart rate. Is it fast? Is it slow? And in addition to the blood pressure. But the actual taking the pulse, you're just checking the rate. Now, in Chinese medicine, we check it on the wrist. And there's actually 3 positions on the wrist. And that's why there's always 3 fingers with the middle finger on the thumb side of the bone on your wrist, and the other 2 fingers distal to it and proximal to that. That means further away and closer. And each position, and then you check both sides, okay? Each position has a different meaning, and it's really interesting if you really get into it. But once again, this is a very basic video. So just in a very basic sense, this side is what they call the yin side, and this side is the yang side. And there's 6 organs associated with yin and yang, very basically. Okay, on the yin side, we're looking at heart, liver, and kidney, yin. And on the yang side, you're looking at lungs, stomach, spleen, and the kidney, yang. So I'm not going to go too much into yin and yang right now, but some of you are probably familiar with the old Taoist philosophy of yin and yang. And so Chinese medicine is significantly based on yin and yang theories. So, but what we're checking here, we're checking 3 different positions, and we're also checking, in general, 3 different depths. So the practitioner will be feeling your wrist in a very superficial way, a sort of a moderate pressure and a deeper pressure. And they can get varying information from that, from the pulse characteristics. And there's many, many different pulse characteristics, which we can go into later sometime. So once again, what is a Chinese medicine doctor doing when he's putting his fingers on your wrist and checking both sides? So that's what's happening. They're checking the not only the speed of the pulse, but the many faceted characteristics of what is to be felt in those positions. So that's pulse checking in a nutshell, in a very basic nutshell. And I hope you find that interesting. And there's just an enormous amount of reading that you can study this type of thing. It's very deep when you study for become a acupuncturist or form a Chinese medicine doctor to learn all these different pulses. And so I just wanted to give you a little bit of a basic idea of what that's all about. So this is Challen with bringing acupuncture mainstream, one talk at a time. And I'll see you on the next video.
Okay, so that was the clearest video that I could find, no, nga madidil talaga and pag palpate han imo pulses. Now, as what the doctor had said, no, there is a tremendous learning, no, and pagbinasa pa when you will really practice also, when you will deal with traditional Chinese medicine and with that palpation pala to ha. So yeah, but it's really interesting to know that there are different facets of medicine, no? Not the normal way that we are learning. Okay, so and you could incorporate it, no. There are doctors also who are incorporating it. Ako gihapon, no, I can really, there are points in the traditional Chinese medicine naman that you could apply with your Western medicine learning. Okay? So pwede mo tiya i-combine. So you could do that when you become doctors. Sige. So I think we have already been enrolled tanan. Zoe, tanan na enroll na. Naka-enroll na.
My one will not continue anymore.
Oh, why?
I don't know.
Uy, pero ka pa, Oday.
I don't feel well.
Why?
I don't
My God.
know.
You diagnose yourself if you have yin or yang. If you have arm cold or cold colds. Sige. So I think that would be all for today. No, we are early. No, we are early, and then next week I'll be dealing with. I'll just show you acupuncture and moxibustion because I really don't know also that. But I'll be looking for materials, and then the other week we will be dealing with Department of Health. The laws, health laws, the different secretaries, and the programs of Department of Health, so that ma-encourage ko kamo nga mag-public health. Public health is one of the most natatagan hin importansya, because we were really nangingiskwela kita, we were really focused on mga specialization. Focused on internal medicine. Ako, I really wanted to become a dermatologist. Zoe knows that. My kuya knows that. I really wanted to become a dermatologist. So, but then many things happened. There are circumstances that happen that will bring you to a different course of your life, and it's okay. I'm happy with where I am right now. So, yun. I'm just 29 years old for everybody's information, but yun. Luckily, unfortunately, I am already in the Department of Health. Yun. So, I think that would be all. Guys, please do your devotions for this morning. Read your Bible, pray. I know you are having difficulties with your lives. I know you have problems. I know you have, may it be for your school or your studies or your family or your personal. Pray for it. That would be all. See you next week, guys. Thank you so much, and good morning, everyone.
Thank you, Doc.
Thank you po,
Doc.
Doc.
Thank you, Doc.
Morning.